Hi everyone, my name is Carla Daniels, and welcome back to another public service announcement. As you know, we try to do these on a monthly basis, and I'm very grateful for your time today. So you're probably wondering, Carla, what's going on? What are we going to talk about today? What's new in the world? What's happening? So today we're going to be discussing measles. For those who may not know what measles is or may have an idea about it but not fully sure, measles, according to the World Health Organization, is a viral disease that is highly contagious. So let's say somebody coughs, somebody sneezes. If it gets into your respiratory tract, it's very easy to get infected. Or you can get it from an infected surface since the droplets last for up to 2 hours. Some of the symptoms for measles include rashes, coughing, very flu-like, but they can lead to very serious things like blindness, ear infections, pneumonia, and even death in some cases. But the thing that makes measles so scary, in a sense, is that measles has no cure. You can only treat the symptoms itself. The U.S. Centers for Disease Control and Prevention, which we will call the CDC from now on, mentioned in 1912 measles became a nationally notifiable disease in the United States, requiring U.S. healthcare providers and laboratories to report all diagnosed cases. Within the first decade of reporting, there was an average of 6,000 measles-related deaths that were reported each year. Many of these measles cases then and now are malnourished children, and really children in general under 5, the immunocompromised, and those unvaccinated against measles, but we'll get to that later. A vaccine for measles wasn't available in the US until 1963, but measles was supposed to be eliminated in the US by 2000, which didn't ultimately happen. We have very low cases, but nothing that was like 0%. Now that we know what measles is, it does bring up an intriguing question. If measles was supposed to be eradicated around 2000 and whatnot, and it's now 2024, why are we still talking about it? I thought things were getting better. I thought things were basically low to none with eradication. What's happening? Measles is on the rise again. 267 measles cases were found in the U.S. under 32 different jurisdictions, which include Maryland, by the way, as of October 2024. 41% of these cases were children under 5, which is no shocker because measles heavily impacts children, but 88% of these cases were of unvaccinated residents of all ages, which have unfortunately led to a lot of hospitalizations. These cases of measles rising are not just the US, it's Asia, Africa, Europe. Some countries include Afghanistan, Cameroon, Austria, but outbreaks in general have globally risen over 50% compared to 2023. I mean, there have been a lot of efforts to spread measles vaccines across the world, but the CDC has now labeled measles as a level 1 threat, which basically is called practice usual precautions. High-level travel areas, the struggle to vaccinate various communities, the rise of the non-vaccination movement, and the cost to receive both of the vaccines, because you do need 2 of them to effectively work, are just some of the issues that have spread measles further. But what can we do to help this vaccines? According to the Journal of Infectious Disease from 2000 to 2018, measles incidence decreased by 66% and deaths decreased by 73%, thanks to what? Routine immunization. Of course, I'm paraphrasing that, but another article expressed that you need 2 things for measles to thrive in. You need a susceptible population, and you need an infectious person. With the vaccines, it's easy to minimize the spread, and you don't have to deal with either of those things, at least to a great extent, as an outbreak. I will say that organizations on a global scale need to focus on providing more resources to undermined communities who don't have access to the vaccines. But for anybody listening who is not vaccinated by choice or got one vaccine, I would definitely suggest getting it, as travelers are getting measles and then bringing it back. The official vaccine is called measles, mumps, and rubella vaccine, and you need 2 doses of it. Not one, but 2. And of course, it's always good to vaccinate your children because measles targets children under 5 and it gets really deadly sometimes, but many institutions and school require it anyway, but it's always better to get it than never. On another note, I think it's helpful to get the measles vaccine because we already discussed how deadly measles can be and it can lead to a lot of hospitalizations. But with these hospitalizations, it can be easier on hospitals and healthcare workers because they can deal with other issues instead of a disease that was preventable in the first place. And just like that, everyone, we are done with our PSA. But I do hope that this was educational. To make an informed decision about getting the measles vaccine, please look at the CDC, World Health Organization, Infectious Disease Society of America, or any other reliable resource that can give you more information about the topic. But as always, please remember to take care of yourself and stay precautious during these trying times. Bye!